We address several of the most pervasive problems in medicine. Fear and anxiety stops many patients from getting the preventative care in both the medical and dental arenas. And the overuse of general anesthesia is rampant even in minor procedures, which drives up cost, major complications like cognitive decline, and even premature death. So I'm Joe Gough. I'm co-founder of Wide Awake VR. We are both a technology platform that creates immersive VR experiences for patients during minor surgeries and uncomfortable medical procedures. We are also the surgical referral network that creates the savings for patients and payers by guiding them to the wide awake surgeons that use our platform in their areas. We address several of the most pervasive problems in medicine. Fear and anxiety stops many patients from getting the preventative care in both the medical and dental arenas. And the overuse of general anesthesia is rampant even in minor procedures, which drives up cost, major complications like cognitive decline, and even premature death. We are the only surgical grade enterprise solution that has delivered in clinical trials on patient safety, patient satisfaction, and cost reduction. 80% of our patients actually called their procedures using WAVR enjoyable. That's an enjoyable surgical experience. And that's because we have some of the best content in the world. Emmy award-winning producers, including our own original content produced by our CEO, David Wheeler, who's the former creative director of EA Games. In less than a year, we have gone from those successful clinical trials to pilots and full commercialization with paid clients in some of the most revered brands in healthcare. Probably the most extensive use case is with Kaiser Permanente, where they've actually wrapped their orthopedic department in Southern California with the preoperative and postoperative instructions and the little brought to you by Kaiser commercial, all presented in VR for the captive audience of the patient. So we see a lot of patient education and marketing applications here with this use case. We are post-revenue now, but we have not completed our seed round, so we're still considering ourselves in year zero here, but we've gotten more than halfway to that year one booked revenue mark already. And that's with just SaaS licensing. So we haven't talked about the shared savings model or leveraged that into the pro forma at all. And obviously that can be a very large shared savings when you're talking about high volume surgical procedures like carpal tunnel, where we can save 70% in many cases by moving the facility fee and the anesthesiology fees. We've also just opened the dental market. We had a very successful study with the Columbia School of Dental Medicine that validated all of our use cases there, helped us bring on, and with all the virtual reality tools, diving deeper with several other major players in dental investing and in research. We will be launching the dental solution at South by Southwest in March. Dr. Zuckerberg and Dr. Clarkson, our chief medical officer and my co-founder, will be leading a panel on medical technology using virtual reality on the opening night of South by. We are raising money, as I said. We've got a $2 million raise. We've raised $750,000 of it. It's a pre-money $8 million valuation. And we have some very strong testimonials as to what we think we can do in the marketplace once we've added the dental market to this solution. Thank you.
All right. Thank you, Joe. That is awesome. I can think of so many use cases for your technology. A question from Esther Dyson: does this also reduce providers' liability insurance costs?
Yeah, that's something that's been brought up. It's a great question. We have had the ambulatory surgical centers come back to us and say that yes, when they remove anesthesiology from procedures, they remove liability, and therefore they can go back and renegotiate that. But I have not seen that in writing, so I don't want to overpromise. I've just heard that anecdotally.
I don't know if this would be possible in terms of the hardware interacting, but I could see MRIs being a really great use case for something like this.
Yeah, there are tools that allow us to use a CinemaVision set of glasses, and we actually have a partnership right now with HTC that's bringing us the dental version of the hardware, which is a lower profile headset that's customized for our use case. And we've talked to them about the next level, using the components necessary to be integrated into radiology.
That's great. And tell us a bit about the competitive landscape.
Yeah, so we don't really look at the competitive landscape the way some other companies do, because as a platform with the health systems that we have that are already using it, we'd like to see a lot of our point solution competitors come onto our platform. The hardware for them in many cases is not profitable at all. They're really trying to sell their FDA approved content for things like PTSD or bipolar disorders. So we would love to host most of our competitors on our platform, but there are certainly players like Applied VR and Behave VR that have raised significant money and kind of validated the market for VR in healthcare. We're just the first ones that have taken it to the patient and put the patient in the surgical arena.
Have you been able to collect any outcomes data for the patients on your platform?
Yeah, so we have 3 successful randomized control trials that have decreased complications, decreased cognitive decline, obviously because you're removing the anesthesiologist, increased the patient satisfaction by up to 80%, increased the efficiency of the operating room and surgical theater because it's moved to office-based procedures, and most importantly, to the payers, reduce the cost by, I mean, it goes as high as 85%. As everybody on this call probably knows, the disparity between what one hospital charges for a procedure and what one specialist charges for a procedure in their office is a massive void that really is only dedicated to facility fees and extra services that are unnecessary and wasteful.
Totally. So just curious, since you're living and breathing this space, where do you see VR in 10 years? What could be the potential implication of just broad scale dissemination?
Yeah, we just did a very small study that I think is conclusive. It's only 28 patients, but of the 28 patients, 26 of those patients actually scored higher on their comprehension and post-operative adherence to their treatment plan. So you can just imagine if every patient that's in a narcotic fog after a procedure and gets 2 sheets of paper as part of their discharge instructions, if they're not in that fog and they get a virtual reality interactive first person explanation for how to take care of their medication reconciliation and for how to take care of things like wound care, you're going to see a lot less readmissions and a lot less unnecessary pain and diminishing quality of life for these patients.